Welcome to the course Pharmaceutical Clinical Pharmacy. My name is Fawad Ali, Assistant Professor, Department of Pharmacy, Ward University of Science and Technology. Today we will discuss about the role of the pharmacist in the community pharmacy. Outlines. In today's lecture, we will discuss the following contents one by one, like community pharmacy, a community pharmacy involvement in healthcare, nutrition and counseling, women welfare, pregnancy and infant care, rational use of the drugs, sexually transmitted disease, for example, AIDS, alcohol, drug abuse, smoking cessation, family planning, individualization of drug therapy, and a conclusion of this topic. Lecture outcomes. After watching and listening, student will know about the role of the community pharmacist in the healthcare system. Okay. What is community? What is the role of community pharmacy? What is community pharmacist basically? A community pharmacist is the professional who would be in direct access to the public and whose duties are widely sought after by the public and the patient, which are in direct which have a direct in direct contact with the public and with the and whose duties are widely sought after the public and the patient. He dispenses medicine. Community pharmacy, the community pharmacist dispenses medicines with a prescription, and in certain cases without a prescription where he gave, for example, like in OTC drugs, the prescription is not required. As community pharmacist is the person who have a direct relation with the public, so he has to play an important role in decreasing the mortality and morbidity in the public. Community pharmacy practice evolved. When this practice started, basically this practice has been started in the post Second World War period. A pharmacist not only began to perform the function that were new to the pharmacy, but they began to innovative functions and make original contribution to the literature. The popular motto of the community pharmacist is patient oriented practice, and drug use control came into the practice. But unfortunately, the role of the community pharmacist is not so much recognized till today, especially in the development countries like Pakistan, India, Bangladesh, and needs strong efforts in this regard. Despite of the major role of the community pharmacy, the situation and the condition of the community pharmaceutical service has stood where it was like a man walking on a treadmill. He walks and sweats but remain in the same place until and unless the link between the people and the physician, that is the pharmacist, does not get its proper recognition, and he dreams of making a nation a healthier nation cannot be fulfilled. So the need of R is to make the community pharmacist a key toward a better health. The community pharmacist can take part in health promotion campaigns locally, nationally, on a wide range of drug related and health related topics. It is the need of the hour to recognize the community pharmacists in the health care system in order to promote to have a better care healthcare system. A community pharmacist involvement could play an important role in the following areas of the healthcare, like nutrition and counseling, women welfare, pregnancy and infant care, rational use of the drug, sexually transmitted disease like AIDS, alcohol, drug abuse and smoking cessation, family planning, individualization of drug therapy. Okay. Role of the pharmacist, the community pharmacist in the nutrition counseling. Community pharmacists can make significant contribution in assuring adequate nutrition by advising his patient about the basic food needs, keeping to correct improper food habits in children, advising on a special requirement, suggesting a special diet instruction for the diabetic patients, people with a food allergy, etc. So there are certain facts such as women who often eat fish, omega-3 fatty acid are less likely to suffer stroke. Symptoms of hypervitaminosis result in irregular menstrual cycles. An excessive intake during pregnancy may cause birth defects even. So the pharmacist can tell these facts to the people to ensure the better health. Nowadays, a designer foods, for example, the nutraceuticals, dietary supplements, have not only gained considerable acceptance, but also have a newfound use and applications. So they are considered to provide medical or health benefits. The community pharmacist could explain these new innovative products and their standardization in order to improve the health of the woman. Okay, when women welfare, pregnancy and infant care. Basically, women are the cornerstones for the effective public health. It is effective. Like it is a corner important play an important role in an effective health, public health. How? And investigating in women translate into, because investing in women translate in investing in family, in community, in the nation. Against the backdrop of the hectic and demanding schedule, women health services receive the least priority when it should be the first. So, a woman goes through different stages throughout her life, each of which has a specific need, and the presence of counselor is needed each of in each one of them. So, here is the community pharmacist who understand the normal cause of pregnancy, infancy as at a distant advantage, or he or she can guide the mother in a simple matter of hygiene and management. Pharmacists can easily manage the pregnancy or different issues by simply counseling, giving some nutraceuticals, some drugs. So the community pharmacist can encourage the breastfeeding and can play a vital role by guiding the mother for protection of the children by following proper immunization schedule, like EPI. Pharmacists can guide the mother to have like proper immunization schedule of the for the child to protect them. Efforts are definitely underway in this area. So the US FDA Office of the Women Health has created Women Health Take Time to Care, a national public awareness campaign where apart from giving information about safe medicine use, they also hold local interactive sessions which are led by the pharmacists and other healthcare professionals. So, like this is a very effective program started by the FDA, for the women's health, like how to improve the human women's health. So there is a Take Time to Care is a national public awareness program started by the FDA. The rational use is important. Like a community pharmacist can advise on the administration of medication, provide information on the storage of medication, and whenever necessary he can counsel the patient. Yes, can advise the like how to administer information, the storage of the medication, and it's for necessary how, when it's necessary, community pharmacists can counsel the patient at every step. Education regarding the disadvantage of polypharmacy can also be given to the patient. Like the community pharmacy also give an education, give some guidance regarding the polypharmacy disadvantages. Drug information system should be set up and access to adverse drug reaction should be made. This is also the community role of the community pharmacy. A community pharmacist should be do therapeutic drug monitoring. He should have a sound knowledge of genotype reporting, like predictive pharmacology. So TDM, like therapeutic monitoring, and should sound knowledge of the genotype reporting. Drug information awareness program should be conducted in this regard to improve the rational use of the drug, to make the people aware of the side effect of certain OTC drugs which they are normally used without any prescription, like aspirin, a wonder drug, has many side, like mostly it causes the gastric ulcers, asthma, and large dose causes tinnitus, ringing like bell in the ear. Regular use of paracetamol can harm the liver because they have certain metabolites, NAPQI, which have disadvantages, especially the it produces harm to the liver and even kidney in high doses. So even pay show difference between the men and women. the the community pharmacies basically counsel, have need the patient need counseling from the community pharmacies, because like for them even pain show differences in men and women, where women respond better to the opioids such as morphine, pentazocine, pethidine. Men responds better to the non-steroid and anti-inflammatory drugs like ibuprofen. Considering the above example, this example, in the best interest of the public health, a community pharmacy can provide counseling to the common people unaware of these side effects. Moreover, the definition of OTC product should be that which does not require the prescription of registered medical practitioner, but which can be sold only under the supervision of the pharmacist. This is what, like for example, most of the OTC drugs are used without prescription. It is used without, basically it is, they are used without prescription. They have side effects, but no one have awareness about the OTC product adverse effect. So OTC medicine should be like that. Like they don't require prescription of the medical practitioner, but they they can be sold only under the supervision of the pharmacist. In a nutshell, there should be a rational use of the drug, like right drug, in right patient, in right dose, at right time. One pharmacist for 2,000 persons can improve access to the medicine and their safe utilization. The existing pool of the community pharmacy in Pakistan can become an important instrument in bringing about this change to improve the medical related issues, adverse effects, to reduce these, to improve the rational use of the drug. For setting higher standard for the pharmacy practice in the country, the essential drug list should be revised by the government, and the availability of the essential drug should be enhanced through the pharmacists. Like the essential drug list should be revised by the government, its availability should be enhanced by the pharmacist. Sexual transmitted diseases like AIDS, like HIV drugs are expensive and beyond the reach of the common man. Or huge resources of the community pharmacists can educate the people in the prevention and information of the AIDS. Another sensitive issue is the increasing number of patients suffering from the AIDS. The number rose from 7% in 1985 to 18% in 1995. Although many classes of antiretroviral are available, like protease inhibitor, nucleoside reverse transcriptase inhibitor, and non-nucleoside reverse transcriptase inhibitor, patient need close monitoring and strict dietary regime is in this case. Explaining to what HIV is, its transmission, risk, education, patient counseling are the component of the counseling that a community pharmacist can provide. Alcohol abuse, drug abuse, smoking cessation, the disease of the alcohol and the drug abuse also come under the preview of the community pharmacist. Like the pharmacist has a key role to help individuals who become dependent upon alcohol. Drug abuse is similar to alcoholism, yet different because it has the gaining more acceptance among the young people. Most commonly, they are young people abuse the drugs. Annual mortality from tobacco use exceed that from other causes combined. Smoking is the greatest single preventable cause of morbidity and mortality worldwide. It is the responsibility of the community pharmacist to take an active role in helping the smoker to stop smoking. Following a number of smoking policy throughout the pharmacy by written information and poster can do this. Like by bringing simple awareness among the people. The pharmacist can advise on the product available to assist the patient in giving up smoking. There should be a, like awareness program having some advices on the product available to assist the patient in giving up the smoking. Counseling sessions can be made by the community pharmacist to stop the smoking. Like there, especially smoking counseling sessions specifically for made by the community pharmacist to for the smokers to avoid smoking. Family planning. One of the greatest need of the hour is to control a tremendously increasing population. So community pharmacy is the one who can control this rising population by counseling with the people and doing programs, awareness program which exhibit the problem related with the large families. Pharmacy, the pharmacist can tell the various family planning measures that are available in the market at affordable prices. He can educate the people and convince them about the advantages of having small families. Individualization of drug therapy. Today, the latest concept in medicine is toward the dose drug individualization therapy, where the judicious patient care is needed. Individualization of the drug therapy become a need, and a pharmacist can play a vital role in that. A physician who is preoccupied with a patient diagnosis and treatment may not spare time for the patient counseling regarding pharmacoeconomic, drug information, alternating therapy, and moral supporting. A pharmacist can set up a separate consultation room, provide counseling to the patient. He can store the details of the patient history, allergies, and other details necessary for the therapy so that the concept of individualization of the drug therapy could be implemented. The ideal frontline pharmacist of the future has been described as a seven-star pharmacist, someone who is equal in excellence to a five-star hotel, yet accessible to everyone, from the richest to the poor. The future seven-star pharmacist will have seven principal roles to play, like caregiver, its decision making, communicator, pharmacist should be a leader, is the pharmacist should be a good manager, should have lifelong learner to learn things, role model, he should be a role model for the others. The community pharmacy with above skills and attitude should make himself an indispensable partner in the healthcare system of the nation. Conclusion. In this topic, like the role of our community pharmacy in the healthcare system, the pharmacist is like we study is underutilized because community pharmacy practice are yet to be established strongly, and pharmacists working in the community pharmacy do not provide patient counseling in the usual situation. We need to work closely with the farmer situation and share or some common experience and frame appropriate guidelines so that the community pharmacists who play a major role in providing better health care can be recognized. References. Thank you so much.